Addressing the challenges of modern healthcare requires world-class management. However, healthcare organisations frequently struggle to reward, develop and empower their managers. All too often, busy clinicians question the value of managers. Some politicians and journalists also view them as part of the problem rather than the solution. Here at the University of York, our research adopts a different view. For us, it is crucially important to recognise managers and develop their capacity and capability. But why is this so important? And why is it so difficult?
The challenge at the moment, though, is that we don't have an awful lot of evidence in terms of actually understanding the level of management capacity in frontline organisations at the moment. There are a lot of national data sets which talk about the size of the management population, so they're helpful, and we can get a sense of how that's changing over time. But that doesn't actually tell us about how organisations actually manage, the actual management practice going on, and whether the managers have the right kind of skills, capability, time, job control to actually do the job.
So we need good management and good leadership to actually enable clinicians to do the great work that they do to make a difference to people's lives every day. So it's really important that we've got highly capable and engaged leadership and management from people who you might describe as generalists, as well as the experts and the clinicians that can deliver the care on the ground, and we work together as a team.
I've had some incredible managers I've worked with. So when I was at Kent Oncology Centre, the clinical leader as such almost bridged a gap between clinicians and managers. But likewise, our managers were very visible. We all shared the same goal of wanting to do the best by our patients. And we had a really good mutual understanding of each other's roles and what they entailed. It's very much about breaking down barriers, having an increased understanding of each other's roles, and then just knowing, everyone comes into work trying to do a good job and working towards a common goal.
We're a system that's under a lot of pressure to deliver today. So we're obviously focused on performance and making sure that we can meet the needs of our communities in as timely a way as possible. But obviously what we also have to do is to create the capacity within our organisations to think about how we can improve services for tomorrow. And that's a constant battle. We have, I think, been drawn into quite a lot of firefighting and fixing today's problems and trying to keep on top of some of the day-to-day pressures. But actually we know that we've got to create the headspace for our leaders and for our senior clinicians to really start to think about how do we optimise what we do, but also how do we transform on the other hand as well.
As clinicians and clinical leaders, very often we find ourselves in situations where the level of service we're providing is so stretched, which then means that we don't get the possibility to be performing other activities that are crucial for the hospital, such as, for example, quality improvement or research or medical education.
In the last few years, there's been an awful lot of negative publicity and comment around managers. Yeah. So they're the proverbial kind of whipping boys in a lot of the national broadsheets and the national media. So for us, this is about kind of raising the profile of management and actually saying these are the people who perform a really important role for the health service and for patients in terms of kind of driving up quality, maintaining a service, keeping the show on the road. So in doing this and actually shining a light on what's actually happening and why managers matters, we hope to kind of try and combat some of those kind of negative stereotypes and put managers back rightly where they should be.
Yeah, I think the first thing that comes to mind is what data and what evidence do we have? I think it would be really interesting to be able to quantify the value that management brings to the NHS.
So I'm really hoping that you are able to highlight the value of management and leadership roles within the NHS, and that we can learn something about what good looks like. And I'm hoping that we can then think about how we can apply that learning to think about future development.
First of all, I mean, we've obviously known about the kind of work of York University in this space for a long time. This is something that really matters to the university. They kind of share our enthusiasm, they share our values around this, and think this is kind of a really important thing, both for the university and for us, and for the NHS in general.
Thank you for watching. Here at York, we specialise in the study of healthcare management, drawing on expertise from across the university. We look critically at what managers do, the challenges they face, and what managers can contribute. Our team includes recognised international experts in the field, focusing on topics such as the management of emergency services, quality improvement, integrated care, and the management workforce. As a team, we hope to expand and develop this work. We are also passionate about management education. We are keen to hear from like-minded practitioners and academics, so please consider joining our learning community.